Hey, let's talk about Dr. Josef's video on the 10 most dangerous prescription drugs.
Some of the most dangerous prescribed drugs out there. Unfortunately, many people taking these medications are never told about the rare but devastating side effects they can cause. Antidepressants. So these are drugs like the SSRIs, things like Lexapro and Prozac, and they're used for treating depression, bipolar, and anxiety. Now, while these medications are often experienced as being calming and therapeutic by many, some people will have paradoxical reactions, meaning that they become more anxious or agitated, or in the worst cases, sometimes even suicidal, homicidal, or even psychotic. ADHD medications. These are drugs like Adderall, Ritalin, or Strattera, and they're used to treat attention deficit hyperactivity disorder in children and adolescents. And honestly, from my perspective, it should not be surprising to people that ADHD medications can cause some severe behavioral problems. They are, after all, mechanistically similar to stimulant drugs like cocaine and methamphetamine. These are drugs that are acting on our dopamine system. Aripiprazole, also known as Abilify. Now, this is an antipsychotic medication, but it's also very commonly used as an antidepressant. For many people, this is a popular antipsychotic to take because it's associated with less weight gain. Most antipsychotics block dopamine. It's associated with things like compulsive behavior, addictive behavior, and sometimes things like disinhibition. I mean, those dopamine receptors is where drugs like cocaine and methamphetamine really act on. It's the smoking cessation drug, Varenicline or Chantix. Now, this is a drug used to help people stop smoking by binding to the nicotinic acetylcholine receptors in the brain. A lot of people started reporting that it was causing a whole range of strange behaviors. The Z drugs. Now, these are a type of sleeping medications, and you may have heard of them. This is things like Ambien, Sonata, and Lunesta. Now, there have been reports of people doing all sorts of things that they could never remember while they were asleep on this drug, like making food, driving their vehicles, making phone calls, and even things like having sex. Mefloquine or Lariam. This is a drug used to treat or prevent malaria, and it's been used since the 1970s. It can actually cause really severe neuropsychiatric side effects. Montelukast or Singulair. Gosh, this is a really popular drug. It's used for asthma and allergies. So it has become the go-to treatment for asthma, especially in kids. Serious side effects that these inhalers don't have. And these are severe psychiatric side effects like becoming suicidal or severely depressed. Isotretinoin, otherwise known as Accutane. Now, this is a drug that is used for treating severe acne. In rare instances, it can cause severe psychiatric side effects that can be catastrophic and sometimes long-lasting. So the next drug is finasteride, also known as Propecia. A small proportion of patients who take this drug develop a condition called Post-Finasteride Syndrome, which is characterized by severe depression, cognitive problems, and also sexual dysfunctions. Fluoroquinolone antibiotics. These are drugs like levofloxacin or Levaquin or ciprofloxacin. These are antibiotics that are used to treat quite common bacterial infections, things like UTIs or sinus infections. I would never allow anyone in my family to take these antibiotics if there were any other options. Now, the colloquial term for what happens on these medications is called being floxed. So if you or someone you love is taking these drugs or considering taking these drugs, please think about these side effects and watch closely for them.
I know Dr. Josef personally, and he's a great person. And this is a great resource because there aren't a lot of people who are trained in psychiatry and they're trained to prescribe medications that have expertise or passionate about sharing how dangerous these things can be if you're wanting to taper off of psychotropic medications. Great resource. Glad you found his video. I want to talk about this video and give a little bit of the take on it from a different perspective in terms of the clinical perspective from a therapist. So my name's Rochelle. I've been a complex trauma therapist for more than 2 decades. I do not prescribe medication, do not claim to be an expert in medication, but I have worked with many people over the years who have been on medication, as well as all of those who come to me for help because they don't want to be on medication. First of all, only a psychiatrist or a doctor can prescribe medication. So that's a misunderstanding from a lot of people. They think a psychologist or a therapist can prescribe medication. That's not the case. You have to go to med school, and so either be a physician or a psychiatrist to prescribe medication. So if you have been prescribed medication, it was prescribed from someone who had a medical background, not necessarily a therapeutic background. my expertise is in therapy. So he mentions as the top two antidepressants, anti-anxiety medications, and then he mentions also stimulants. So I want to talk about those couple things because in my clinical history, what I have found is that the most common thing people struggle with is difficulty moving through emotions, emotional regulation. And when people can't effectively move through emotion, they have to work extra hard to control things in their life, whether that's through achieving or people pleasing or being concerned about things or being the ones that take care of everything to avoid experiencing emotion. And this causes them to operate at a very high level of stress. People that do not have healthy emotional regulation, it's not because they're not intelligent. It's not because they don't have a strong faith. It's not because they're not well-adjusted people. But most people who do not move through emotions easily and operate at a high level of stress, whether that's fight, flight, or freeze, didn't have a lot of help early on moving through big emotions as a child, or they've been in situations where they've been in a state of chronic stress for a long period of time, or they had some trauma that happened to them and they haven't been able to move out of that fight, flight, or freeze. There's this underlying emotional dysregulation that's the number one predictor of a high stress response. So when someone goes and wants to get on, they go to their doctor and they say, I really need something because I'm not sleeping at night, or my anxiety's high, or the doctor notices that you've got really high blood pressure and you've got all these symptoms of stress are showing up in the body, and they prescribe something. What most people don't know is that the drugs are only tested for like 6 months. Usually they're prescribed a medication with oftentimes nothing else to help them fix the underlying problem. While it might treat the symptom initially, it doesn't really fix the underlying problem. You should listen to Dr. Josef about the impact of the medication because, again, he's the expert in that area. But what I hear from people is that I don't feel like myself. It stopped working. It causes me to numb out. Sexual performance issues often come up with medication. Feeling just numbed. I can't cry. I feel just blah all the time. It's not a good state. And without really being given new neural pathways to have healthy emotional regulation, medication doesn't fix the problem. You know why? Because it doesn't address the underlying problem. It just says, here's a Band-Aid solution to cover this. People that go on anti-anxiety medication, depression medicine, I can't think of a time actually, and again, my perspective is a little bit biased because I'm a therapist, so people didn't come to me when they were feeling at their best. But nobody says, I've been on medication for 20 years and I feel fantastic. People might say, I got relief, but then their body adapts to it. It stops working. They try something else. They're dealing with side effects, and they haven't been given the underlying tools to really allow their nervous system to live in a relaxed state while being engaged and present. So then they're in the kind of this numbed out state. Another thing that I see happening with stimulants in particular is that a lot of people will go through seasons of burnout or overwhelm where they have been going, being so resilient. They're the ones that take on everything, fix everything, perform at a high level, hold themselves to a high standard, maybe kind of perfectionistic, and just really, they don't even realize, but they've suppressed. And their body is showing symptoms of that chronic stress, but they've always operated at a high level. But now all of a sudden, they've got some brain fog, memory issues might be showing up. They might say, it takes me longer to complete tasks. I just can't think through things as clearly. I've even had many ladies say I took a sabbatical, or I thought if I changed jobs and moved to a different situation, the stress level would be less, and yet they find that they're stuck in this state. Well, when they start noticing these cognitive issues, again, going to their doctor, it might look like ADHD. Oh, you have trouble focusing, you're having memory issues, you can't shut your mind off at night, you're not sleeping well, you can't relax. Here's a stimulant. Guess what? These things are really addictive. They don't fix the problem. If you're experiencing these things now, do some people have ADHD? I'm sure they do. Oftentimes, this would have been something that would have been identified earlier in life, not, perimenopausal age after you've been working and operating at this level. Symptoms can look many different ways, or symptoms that look the same. There's many different causes. So it depends on what lens you're looking through. So if you are a physician and the tools tools in your toolbox are to prescribe medications, and you're going to look at someone with brain fog and memory issues and sleep problems and say, oh, here's a stimulant. In my experience, that's not been helpful. And so, not that I have personally taken them, I haven't personally taken them. I work with women going through overwhelm and burnout, and I have not seen that to be effective. If you're on medication, you're not feeling like your best version of yourself and you're needing to get off, listen to Dr. Josef. He's a pioneer because not many people are teaching the get off, right? It's easy to start a prescription. It's much harder to stop it, and it should be done safely under the care of someone who knows what they're doing. But even if you get off of medication, there are underlying issues that cause someone to be living in a state of hypervigilance, high stress. There are underlying reasons why someone can't process through emotions. There are underlying reasons why trauma hasn't been released and processed and is leading someone to have PTSD-like symptoms. I love it that he's getting information out there and helping people and doing amazing work in being able to get people off of medication and spread the word that these things should not be taken lightly and are many times overused and, in my opinion, given to many people who could be helped otherwise without them. I hope this is helpful. Again, my name is Rochelle Walsh. If you're new to me, I'd love for you to listen to some of my other content and subscribe. I have a transformational program for women overcoming overwhelm and burnout. I'm just really passionate that we all have one life to live, and we need to live in the best emotional and mental state that we can to make the most of the time here and live more fully in our purpose. So I hope this is helpful, and hats off to Dr. Josef for doing such great work.